had coronavirus in the last few months could be at risk of fatal complications, experts have warned. This was some research published in Nature Medicine this week on the effects that being infected with COVID actually has on a person's heart. Researchers in the US looked at 150,000 people who had COVID against 11 million who never had the virus. For those who had COVID, their risk increased regardless of their age or their previous health conditions. Their heart attack risk increased by 63%, their risk of coronary artery disease increased by 72%, and their risk of a stroke by 52%. The researchers said that these conditions could strike months after infection. It's important to note here that the majority of people in this study may have not actually received a coronavirus vaccine. This is because the study was conducted way before vaccines were being rolled out globally. But some of the people may also have been infected with older variants, such as the variant that first washed up on our shores in March 2020, or the Alpha variant. And as we know, the Omicron variant is less severe than those that came before it, but it's still important that you get your vaccines because these protect you from severe illness. The experts noted that because of the long-term nature of these conditions, they said that governments across the world now need to do more to make sure people with long-term conditions get the help they need. The UK government has actually set up long COVID centres across the country to help people suffering from long COVID. If you're worried about any symptoms, you should speak to your GP, whether that's heart symptoms or symptoms you think might be related to long COVID.